Good day, everyone. So, for the first part of our report, I will be discussing hemonchosis in goats, which is an important parasitic disease under veterinary systemic pathology. So, this disease is commonly encountered in small ruminants and is especially significant because it can cause severe anemia and even death if not properly managed. Hemonchosis mainly affects the abomasum, which plays a key role in digestion and overall health. So, hemonchosis is caused by Hemonchus contortus, which is a nematode parasite that lives in the abomasum of animals, or particularly ruminants. So, this parasite is also known as the barber pole worm because of its characteristic appearance, where the blood-filled intestine twists around the white reproductive tract. What makes this parasite particularly dangerous is that it is hematophagous, meaning it feeds directly on the host blood, leading to rapid blood loss. The main clinical signs of hemonchosis include weight loss, anemia, ascites, and submandibular edema, commonly called bottle jaw. So, anemia is the most important clinical feature and is caused by continuous blood loss from parasite feeding. Because of this, affected goats often appear weak and lethargic, and the swelling seen in bottle jaw occurs due to low protein levels in the blood, which allows fluid to leak into surrounding tissues. So, this image here shows a goat with bottle jaw, which is one of the hallmark signs of hemonchosis. The swelling under the jaw is commonly caused by edema, not fat or muscle enlargement, and it results from hypoproteinemia, where reduced plasma proteins decrease oncotic pressure, allowing the fluid to accumulate into the submandibular region. This sign strongly suggests a parasitic infection, particularly in grazing animals. This slide shows both the macroscopic and microscopic features of Hemonchus contortus. So, grossly, adult worms can be seen attached to the abomasal mucosa during post-mortem examination, and microscopically, the parasite has small buccal capsule and cervical papillae. The male worm is identified by its copulatory bursa with two lateral lobes and a Y-shaped dorsal ray, while the female shows different vulvar forms, which are useful for species identification. The next slides demonstrates the use of Famacha chart, which is a practical field tool for assessing anemia in goats. So, by comparing the color of conjunctiva to the chart, veterinarians can estimate the severity of anemia caused by Hemonchus contortus. So, pale conjunctiva indicates severe blood loss and helps guide decisions on treatment and parasite control. So, the next slide illustrates the developmental life cycle of Hemonchus contortus. So, goats become infected by ingesting infective L3 larvae from contaminated pasture. So, this larvae develops into adults in the abomasum, where they attach to the mucosa and begin feeding in blood. So, continuous blood loss, blood feeding leads to anemia, protein loss, and ultimately the clinical signs observed in infected animals. So, in this stage of the disease, the damage becomes systemic, and blood loss caused by adult worms results in anemia, while protein loss leads to hypoproteinemia. So, this two process disrupts normal circulation and fluid balance. So, as a result, affected goats develop edema, weakness, and reduced productivity. And in severe cases, the disease may be fatal if intervention is delayed.
Okay, so now that we learned the cause, etiology, the pathogenesis, as well as the clinical signs of hemonchosis in goats, we're going to deep dive into its gross lesions. So here in the first image, you can see that the abomasum shows marked congestions and hemorrhages on the mucosal surface, giving it a reddened and inflamed appearance, and the mucosal folds are also thickened, rough, and edematous, indicating chronic irritation and inflammation. This occurs because Hemonchus contortus attaches to the abomasal mucosa and feeds on blood, causing continuous blood loss and tissue damage. In some areas, nodular lesions and petechial hemorrhages are also visible, reflecting signs of parasite attachment and capillary rupture. And yeah, we can see that there's those folds right there in the pictures. And so yeah. And then in here, we can see that the image clearly shows numerous adult Hemonchus contortus worms attached to the abomasal lining. The worms are slender and thread-like, often described as barber's pole worms due to the blood-filled endocyne in females. Their heavy presence indicates a high parasite burden, which directly correlates with severe anemia. And the close attachment of the worms explains the ongoing blood loss, leading to hypoproteinemia and weakness in affected animals. And then we're going to move on as to the cause or the effect of the anemia. So in here, we can see that there is a pale conjunctiva that's occurring in the goat. So this is actually a classic gross indicator of severe anemia caused by the chronic blood-sucking activity of the parasite. So normally the conjunctiva should be pink or a little bit red, but in hemonchosis it becomes pale to almost white. In the right image, we can see that there is a bottle jaw or a submandibular edema, which is caused by low plasma protein levels or hypoproteinemia. Reduced oncotic pressure allows fluid to leak into independent tissues, especially under the jaw. And then here we can see in the last image right here that the bottle jaw is more pronounced with extensive edema, as well as evidence of hemorrhage in the submandibular tissue. So this indicates an advanced and severe stage of hemonchosis. This presence of the blood-tinged fluid reflects the vascular damage as well as severe protein loss and compounded by anemia. So at this stage, the affected animal are usually weak, emaciated, and may die if not treated promptly. So we can see here that this is basically this is doing necropsy. So you can see that there's edema in the submandibular jaw, and then that's basically it. Now that we've learned the gross lesion, we're going to move on to the histological lesions. Now, in the histological examination, the damage becomes more evident. So, in here, you can see that in low magnification, it shows a denuded surface epithelium with damaged gastric pits. So, the loss of epithelial lining suggests erosions caused by the parasite attachment and feeding activity. So, this lesion compromises the protective barrier of the abomasum, predisposing the tissue to further injury and bleeding. So yeah, we can see it there. In this section as well, there is a marked cellular infiltration and hemorrhage in the submucosa. The hemorrhagic areas are consistent with blood-feeding behavior, Hemonchosis contortus, and this explains the development of anemia commonly observed in animals. So yeah. And then in the third picture, we can actually see a cross-section of the worm within the abomasal tissue, which is surrounded by a dense inflammatory cell infiltration, and the presence of the parasite embedded in the tissue confirms its active infection. And so yeah. And then another example of the histological lesions is here. So the first picture, we can see that in this section of the abomasal fundus, there is a marked infiltration of eosinophils within the lamina propria and submucosa, which is typical, again, of parasitic infection. Aside from that, in the second picture, you can see the damaged and degenerating parietal cells within the submucosal glands, and this degeneration of these acid-secreting cells suggests direct tissue injury caused by the parasite. So this interferes then with the normal gastric secretion, and such damage may actually impair digestion and contribute to the altered abomasal function. And so in the third image, you can actually see here that the chief cells remain relatively intact, indicating that not all glandular components are equally affected during infection. However, there is still evidence of surrounding infiltration, suggesting ongoing irritation. And lastly, in that last picture right there, in the fourth picture, this section actually shows the presence of neutrophils as well as lymphocytes within the submucosa, again indicating chronic inflammatory response. And that basically it is the gross lesion and the histological lesions for the hemonchosis in goats. Thank you.
Okay, so for our next topic, we have edema disease. So, edema disease is an important condition in the swine industry because it can cause sudden death in apparently healthy piglets, especially those after weaning. So, in this presentation, I will be talking about the clinical features, the etiology, the pathogenesis, and the predisposing factors of this disease in pigs. Okay, so what is edema disease? Edema disease is a toxinemic disease of pigs, most common within the first few weeks after weaning. So it may occur sporadically, affecting only a few pigs, or as a herd outbreak where many pigs are affected at the same time. In some cases, the first sign noticed is sudden death without prior clinical signs. So unlike many other enteric diseases, edema disease typically presents with little to no diarrhea, and fever is usually absent. The disease is characterized by subcutaneous edema, particularly of the eyelids and the forehead, along with neurologic signs. It usually affects rapidly growing, well-conditioned piglets, which is why it is often seen in pigs that appears healthy and well-fed prior to the onset. There are also subclinical and chronic forms which may not cause death but result in poor growth and persistent neurologic deficits. Overall, the severity of the disease can range from per-acute death to mild self-limiting edema. So the image shown here demonstrates a pig exhibiting neurologic signs associated with edema disease. So affected pigs may be seen lying in a lateral position with paddling movements of the limb indicating movement of the nervous system. These neurologic signs occur due to vascular damage and edema within the brain, which interferes with normal nerve function. In severe cases, pigs may become recumbent, show incoordination, vocalize abnormally, and eventually die. So the causative agent of edema disease is the specific strains of Escherichia coli that produces Shiga toxin type 2E, also known as your STX2E. These strains are usually non-enterotoxigenic, which explains why there is little to no diarrhea in affected pigs. The bacteria colonize the intestine, particularly after weaning, but they do not primarily cause intestinal damage. Instead, the toxin produced by the bacteria is absorbed into the bloodstream, leading to systemic effects. These strains are often classified as Shiga toxin producing E. coli, also referred to as the STEC or your VTEC, and specifically as EDEC or edema disease causing E. coli. So the pathogenesis of your edema disease centers on the action of the Shiga toxin. After the toxin is absorbed into the bloodstream, it targets vascular endothelial cells, particularly those in the small arteries and the arterioles, and the toxin causes endothelial damage, leading to increased vascular permeability. As a result, fluid leaks out of the blood vessel into the surrounding tissue, producing edema. This edema is especially prominent in subcutaneous tissues such as the eyelids and forehead, and critical organs like the brain and the gastrointestinal tract. Edema in the brain leads to neurologic signs, while vascular damage throughout the body contributes to the toxinemic nature of the disease. Ultimately, severe vascular injury may result in sudden death even before obvious clinical signs develop. So, several factors predispose pigs to developing edema disease. The most important factor is recent weaning, which causes significant stress and alters the gut flora. A sudden change in diet, particularly diets that are high in protein, promotes the proliferation of the pathogenic E. coli in the intestine. Stress and overcrowding weaken the pig's immune defenses, making them more susceptible to infection. Lastly, poor hygiene increases environmental contamination and exposure to pathogenic bacteria. Together, these factors create ideal conditions for colonization by Shiga toxin producing E. coli and subsequent development of edema disease.
So, for the clinical signs of edema disease in pigs, this disease often has a per-acute to acute onset, so pigs may appear normal and then suddenly become ill or die. So, one of the most striking signs is sudden death, which occurs due to severe vascular damage and toxemia affecting vital organs, particularly the brain. So, edema of the eyelids and face is a hallmark sign and results from increased vascular permeability caused by the toxin. So, fluid leaks from blood vessels and then accumulate in the subcutaneous tissues, especially around the eyes and face. So, neurologic signs such as ataxia and squealing occur because the toxin damages blood vessels in the brain, leading to cerebral edema. So, affected pigs may vocalize excessively due to pain or neurologic dysfunction. So, as the disease progresses, pigs may become recumbent and show opistotonus, which is the abnormal backward arching of the head and neck. So, this indicates severe involvement of the central nervous system and usually suggests poor prognosis. So, here we have these images that shows recumbency and opistotonus. So for the recumbency, it occurs when affected piglets lose the ability to stand due to neurologic dysfunction and muscle weakness, which is caused by the edema in the head of the animal. So next is we have here the apostatonus, which is characterized by rigid extension and backward arching of the head and neck. So it reflects severe involvement of the central nervous system, particularly the brainstem. So this sign usually indicates poor prognosis and often precedes death. So on post-mortem examination, the most consistent gross lesion in edema disease is gelatinous edema affecting specific tissues. So these are observed in the eyelids and face, which correlates with the facial edema seen clinically. So the edema has a clear jelly-like appearance due to protein-rich fluid accumulation. So these are also frequently found in the gastric fundus, musicolon, and larynx. So these are particularly affected because the toxin targets small blood vessels, causing endothelial damage and fluid leakage. So serous effusions may be present in body cavities such as the abdominal or thoracic cavity, again reflecting widespread vascular injury. So despite the severe systemic effects, the intestines are usually grossly normal, which helps differentiate edema disease from other enteric diseases. So this is because the primary action of the toxin is vascular rather than causing direct intestinal inflammation. So for the left side na image, the image shows severe edema of the gastric wall, particularly along the large curvature. So the wall appears thickened and gelatinous due to the fluid accumulation within the submucosa. So this occurs because Shiga toxin damages, as mentioned, damages the vascular endothelium, increasing permeability and allowing plasma to leak into surrounding tissues. So the stomach is basically a classic site affected in edema disease. So for the right na image, we have the edema of the coiled colon in a winner with edema disease. So basically, it demonstrates edema of the mesocolon and the coiled colon, seen as translucent swollen appearance. So this lesion reflects systemic vascular injury rather than primary intestinal inflammation. So next, here on the left side, we see bilateral pulmonary congestion and edema accompanied by mediastinal edema. So these findings indicate widespread vascular leakage affecting the lungs and thoracic tissues. While not always be the primary lesion, pulmonary edema can contribute to respiratory distress and sudden death. So on the right side, we have this diffuse minimal cerebral congestion and edema. So basically, it is responsible for the neurologic signs observed clinically, such as ataxia, squealing, and opisthotonus. So even minimal edema within the brain can cause significant neurologic dysfunction due to increased intracranial pressure. And next is we have the edema of the eyelids and the mild bulbar conjunctival congestion. So basically, it is one of the most characteristic and easily recognizable lesions of edema disease. So the loose connective tissue around the eyes allows fluid to accumulate rapidly following endothelial damage. So now we proceed with the histologic findings in edema disease. So first, we have here the fibrinoid necrosis of arterioles, which is basically the hallmark microscopic lesion in edema disease. So it results from severe endothelial injury leading to leakage of plasma proteins and fibrin into the vessel wall. So this weakens the vessel and disrupts the normal blood flow. Next is we have the endothelial damage. So as mentioned, the Shiga toxin directly targets vascular endothelial cells, causing swelling, degeneration, and loss of integrity. So this endothelial injury is the primary event that triggers edema formation throughout the body. And the next is we have the perivascular edema. So basically, it is evident as fluid accumulation around blood vessels. So this occurs secondary to increased vascular permeability and is responsible for many of the grossly visible edematous lesions. And last is we have the brain edema and neuronal degeneration. So in the brain, vascular damage leads to cerebral edema, which compresses neurons and interferes with oxygen delivery. So this results in neuronal degeneration, explaining the severe neurologic signs and high mortality associated with the disease. So we have here in the left side, the image actually shows a necrosis of smooth muscle cells in arterioles. So basically, it has this necrosis in the tunica media of a small arteriole. So features such as pycnosis and cardiorexis indicate irreversible cell injury. So damage to the vessel wall further compromises vascular integrity, worsening edema. So next we have here on the right side an image which demonstrates cerebrospinal angiopathy characterized by hyaline degeneration of arteriolar walls and perivascular eosinophilic droplets. So these changes are classic for edema disease and reflect chronic toxin-induced vascular injury in the central nervous system. So we have here an image that shows fibrinoid necrosis of a myocardial arteriole in a pig with edema disease. So the lesion is characterized by its bright eosinophilic fibrin-rich material within the vison wall, indicating severe endothelial injury. So these vascular lesions can impair blood supply to cardiac muscle, contributing to myocardial dysfunction, arrhythmias, and sudden death, which are common clinical outcomes in edema disease. We have here the prevention and control of edema disease in pigs. So first we have here gradual dietary changes. So gradual dietary transitions after weaning help prevent sudden shifts in intestinal flora that actually favor the proliferation of Shiga toxin producing E. coli. So abrupt feed changes are a major predisposing factor. Next we have here good hygiene. So strict hygiene reduces environmental contamination, oral exposure to pathogenic E. coli. So clean pans, feeders, and water sources are essential in controlling disease spread. And then next we have here reduced stress of weaning. So stress from weaning suppresses immunity and alters gut motility, so increasing susceptibility to infection. So minimizing stress through proper handling, adequate nutrition, and environmental management is critical. Lastly, we have here vaccination kung sila available. So vaccination against Shiga toxin producing E. coli can significantly reduce the incidence and severity of edema disease by inducing protective immunity against the toxin.
So we're going to talk about Clostridial enterotoxemia in ruminants. So first off, Clostridial enterotoxemia is an acute toxin-mediated disease of ruminants caused mainly by Clostridium perfringens type C and type D. The organism is a normal inhabitant of the intestinal tract and is usually present in small numbers without causing disease. However, when there is a sudden dietary change, such as increased intake of milk or highly fermentable carbohydrates, the intestinal environment becomes more favorable for rapid bacterial multiplication. As the bacterial population increases, excessive amounts of potent toxins are produced within the intestine. These toxins cause severe damage to the intestinal mucosa and, once absorbed into the bloodstream, result in systemic toxemia. Because toxin production and absorption occurs very rapidly, affected animals often show few or no premonitory signs and may be found dead suddenly. The disease is most commonly observed in rapidly growing or well-fed animals, such as lambs, kids on a high-energy diet, which explains why Clostridial enterotoxemia is often referred to as a disease of good management. Overall, the condition reflects the interaction between nutritional factors, intestinal microflora, and toxin production rather than direct bacterial invasion. So again, Clostridial enterotoxemia is caused by Clostridium perfringens type C and type D, which are gram-positive anaerobic spore-forming bacteria. These organisms are normal inhabitants of the intestinal tract of ruminants and are commonly found in the environment, including the soil and feces. The disease does not result from bacterial invasion of tissues, but rather from the production of potent exotoxin. In type C infections, the primary toxin involved is beta toxin, which causes severe necrosis of the intestinal mucosa. In type D infections, epsilon toxin is produced and absorbed into the circulation, leading to systemic vascular damage, particularly in the brain and kidneys. Therefore, the severity of Clostridial enterotoxemia is mainly due to the action of toxins rather than the presence of the bacteria itself. Several predisposing factors contribute to the development of Clostridial enterotoxemia. One of the most important is sudden dietary change or overfeeding, especially diets high in carbohydrates. These conditions provide an ideal environment for rapid bacterial proliferation in the intestine. In neonates, excessive milk intake is a major risk factor, particularly in animals that consume large volumes of milk at one time. This favors the multiplication of Clostridium perfringens and increases toxin production. Young age is another significant factor, as neonates and young animals have an immature immune system and reduced ability to neutralize toxins. Stress and concurrent diseases further compromise the animal's defense mechanisms, making them more susceptible to toxemia. And finally, inadequate vaccination plays a crucial role as well, as vaccination is the primary preventative measure against Clostridial diseases. Animals that are not properly vaccinated lack protective antibodies against the toxins, predisposing them to sudden and often fatal disease. So as for the pathogenesis, this diagram illustrates the general pathogenesis of Clostridial enterotoxemia in ruminants. Although it is classically used to explain type D, the early steps are common to both type C and type D. It's just that the difference lies in the toxin produced and its effects on the intestinal epithelium. So the pathogenesis begins with excess nutrients in the intestinal lumen, usually due to sudden dietary change again, or overfeeding, or increase in milk intake, which creates a favorable environment for the rapid proliferation of Clostridium perfringens, which is normally present in the gut. So as the bacteria multiply rapidly, they produce large amounts of toxin. At this point, the disease pathway diverges depending on the toxin produced by the strain. And as for type D enterotoxemia, Clostridium perfringens produces epsilon prototoxin, which is activated by trypsin in the intestine to become epsilon toxin. As shown in the diagram, the epsilon toxin disrupts tight junctions between intestinal epithelial cells, resulting in increased intestinal permeability. This increased permeability allows the toxin to cross the intestinal barrier and enter the circulation. So once in the bloodstream, epsilon toxin causes widespread vascular endothelial damage, particularly in the brain and kidneys, leading to edema, hemorrhage, neurologic signs, and the characteristic of pulpy kidney lesions. In contrast with type C enterotoxemia, it is caused by beta toxin. Instead of primarily increasing permeability, beta toxin causes direct necrosis of the intestinal epithelium. So this results in severe mucosal sloughing, hemorrhage, and necrotizing enteritis. The destruction of the intestinal mucosa allows toxin absorption into the circulation, leading to shock and sudden death, especially in neonatal ruminants. So although beta toxin is not specifically shown in this diagram, the epithelial damage illustrated conceptually represents the intestinal necrosis seen in type C enterotoxemia. In both type C and type D, once toxins enter the circulation, systemic toxemia develops, which explains the per-acute course and high mortality of the disease. Therefore, Clostridial enterotoxemia in ruminants is a toxin-mediated disease where excess nutrients trigger bacterial overgrowth, toxin production, intestinal damage, systemic absorption, and sudden death. So, the clinical signs of Clostridial enterotoxemia are usually acute to peracute in onset. In many cases, animals may appear apparently healthy and are then found dead suddenly, which is a characteristic of this disease. In affected animals that do show signs, the earliest manifestations are nonspecific and include sudden depression, lethargy, or dullness. This is commonly accompanied by abdominal pain and abdominal distension due to intestinal involvement. Diarrhea may be observed and can range from watery to hemorrhagic, particularly in cases of severe intestinal damage. As the disease progresses, animals often become recumbent and show reluctance of inability to stand due to systemic toxemia and weakness. In severe cases, death may occur rapidly within hours of onset. In enterotoxemia caused by Clostridium perfringens type D, neurologic signs are prominent due to the absorption of epsilon toxin into the bloodstream and its effect on the central nervous system. Affected animals may exhibit abnormal respiratory patterns, including deep or shallow respiration, as a result of central nervous system involvement. Oral automatisms such as champing of the jaw and teeth grinding may also be observed. As toxemia progresses, animals can develop muscle tremors and convulsions. Neurologic dysfunction may manifest as head pressing, circling, and abnormal or uncoordinated movement. These signs reflect cerebral edema and vascular damage caused by epsilon toxin. In advanced cases, severe neurologic signs rapidly progress to coma and sudden death. Overall, the combination of acute gastrointestinal signs and prominent neurologic manifestations, particularly in type D infections, explains the rapid course and high fatality rate of Clostridial enterotoxemia in ruminants.
So, good day everyone. So, today I am going to present a topic still under Clostridial enterotoxemia in ruminants. So, this slide shows the gross lesions observed during a necropsy, and these findings are crucial for a definitive diagnosis of this often fatal disease. So, first gross lesion that can be observed in Clostridial enterotoxemia in ruminants is the hemorrhagic enteritis. So this is the first and most prominent lesion in which there is a severe hemorrhagic enteritis primarily affecting the jejunum and ileum. You will observe a dark red congested mucosa, and the intestinal lumen will be filled with blood-tinged fluid. This is a direct result of the potent toxins produced by Clostridium perfringens, causing massive tissue damage and hemorrhage. Next is the pulpy kidney. So this is the classic sign particularly associated with Clostridium perfringens type D, the cause of overeating disease. So the kidneys appear soft and mushy or pulpy due to rapid autolysis post-mortem, and the cortex is often hyperemic or congested with blood, and this rapid degeneration is caused by the epsilon toxin, which damages blood vessels and tissues throughout the body, including the kidneys. Next lesion is the pulmonary edema or congestion, in which the lungs are also affected by the systemic action of the epsilon toxin. So you will find that the lungs are wet, heavy, and congested. There is significant fluid accumulation or edema in the lung tissue, leading to respiratory distress before death. And lastly, we have the cerebral edema, in which the final key lesion is swelling of the brain or cerebral edema. The brain tissue will often appear swollen, and you may also find small focal areas of softening or malacia, or what you've observed is the malacia foci. And then this neurological damage is often a result of the epsilon toxin affecting the cerebral vasculature and contributes to the sudden death often seen in affected animals. So in summary, the combination of intestinal hemorrhage, pulpy kidneys, and systemic edema provides a clear picture of the devastating effects of Clostridial toxins on the ruminant's body. So on this slide, still under the gross lesion, is on the left side is that the intestine contain a segment of bowel that is dark red to purple and marked as the necrohemorrhagic enteritis. So what we are seeing here on the left side of the picture is the primary site of infection of the Clostridial enterotoxemia. So this is the segment of the small intestine, typically the jejunum and ileum, that is severely congested and has turned a dark red to purple color. And this is an indicative of necrohemorrhagic enteritis, common in type C enterotoxemia in lambs, or lamb dysentery, or struck in adult sheep. The toxins, specifically the beta toxin in type C, cause necrosis or death of the tissue, specifically the villi, and severe inflammation, leading to a breakdown of a gut wall and hemorrhage into the lumen. And the right side of is the picture of the kidney longitudinal section of a lamb, in which the renal cortex and medulla is diffusely reddened, suggestive of hemoglobinuric nephrosis. So this slide shows a pathognomonic lesion of type D enterotoxemia, which is often called the pulpy kidney disease. So the kidneys in this disease the kidneys of these disease are soft, friable, and exhibit a deep reddish brown color, which is a result of hemoglobinuric nephrosis. This often occurs because toxins have caused massive intravascular hemolysis, in which the red blood cells are breaking down in the bloodstream, releasing hemoglobin, and which damages the kidney tubules, causing them to turn this distinct red color. So gross lesion, still under Clostridial enterotoxemia in ruminants. So on the left side is the picture of the right lung of a lamb that has severe diffuse pulmonary edema with expansion of the intralobular septa by dark red fluid. So this is the view of the lungs showing severe diffuse pulmonary edema. So you can observe the expansion of the interlobular septa filled with dark red fluid. And then this, along with froth in the trachea, is a direct result of the epsilon toxin from Clostridium perfringens type D and increasing the vascular permeability, leading to leaking into the lungs of the fluid and causes severe respiratory distress and often contributes to a rapid death of the animal. Next, on the right side is the picture on the gross lesion of the still under Clostridial enterotoxemia is the cerebellar vermis herniation and cerebral edema. So this is a close-up of the cerebellum showing cerebellar vermis herniation, and this is a often fatal result of severe cerebral edema or the swelling of the brain, and the epsilon toxin causing this damaged blood vessel in the brain to leak fluid, which increases the pressure and forcing the brainstem downward through the foramen magnum. So now we will discuss the specific histopathological findings associated with Clostridial enterotoxemia in ruminants as summarized on this slide. So these findings helps us understand the severe, often rapid damage caused by the toxins produced by the Clostridium perfringens types, particularly type D. So let's break down the key areas of impact. So first is in the gastro-intestinal tract, we have here the mucosal necrosis. So the primary site of action of the epsilon toxin is the small intestine, in which the toxin causes severe damage to the intestinal lining. So this results in mucosal necrosis, which is the death of the tissue lining in the gut. And then we can also observe significant epithelial sloughing, where the surface cells are shed, exposing the underlying tissue. and then this is accompanied by crypt loss. So the crypts of Libercon are lost and leading of meaning the glands responsible for generating new intestinal cells are destroyed. So this damage leads to a loss of gut integrity and function. So the tissue damage often triggers a strong inflammatory response. So we see some of the neutrophilic infiltrates, which are large numbers of white blood cells, and then migrating to the site of injury, which we will be showing on the next slide. And then next is the brain, in which there is a perivascular edema and neuronal necrosis. So the epsilon toxin is absorbed from the gut into the bloodstream and travels to the brain, where it has a profound effect on the blood vessels. It increases their permeability, leading to perivascular edema, which is swelling around the blood vessels. So this swelling cuts off oxygen supply to nearby nerve cells, resulting to neuronal necrosis or the death of the brain cells. So this is why affected animals often show severe neurological signs before death. And then next is the neutrophilic infiltrates. As what I have said earlier, neutrophilic infiltrates is large numbers of inflammatory cells. Specifically, the first line of inflammatory cells, we have the neutrophils and then the macrophages. They are migrating to the site of injury, and then this indicates that the submucosal acute inflammation, and there is a rapid and severe immune reaction just below the damaged surface layer of the intestine. So next is the kidney, that has a tubular necrosis and cortical hyperemia. The kidneys are also affected, in which the toxin causes tubular necrosis, or the damage of the small tubes within the kidney, and that is responsible for filtering wastes, and this impairs kidney function. And then we can also observe the cortical hyperemia, which is an increased blood flow to the outer part of the kidney, likely another sign of the toxin's effect on the blood vessels. And lastly, we have the pulmonary, or the lungs. We have here the alveolar edema and hyaline membranes. So in the lungs, the toxin is increasing the permeability of the small air sacs, or the alveoli, that allows the fluid to leak out into the air spaces, causing alveolar edema. The protein-rich fluid and the dead cells can form a layer called hyaline membrane on the surface of the alveoli, severing and hindering the animal's ability to exchange metabolic wastes and other gases such as oxygen, that contributing to the respiratory distress, because it hinders the ability of the animal to breathe and releasing of gases. So in summary, these findings in the histopathologic findings of enterotoxemia is damages, or there is failure of multiple organs, that highlights, and it also highlights the systemic and devastating nature of this disease, driven by the potent epsilon toxin released by the Clostridium perfringens, typically the type D. So still under the histopathologic findings, so on the left side is the picture, or the microscopic viewing of a more severe hemorrhages and necrosis on the tips of the villi that are observed. So under the microscope, under the hematoxylin and eosin stain, we can see the severe impact on the intestine, in which the villi are showing severe hemorrhage and destruction. And on the right side is the perivascular and vascular intramural edema in the brain. So this microscopic view of the brain highlights the damage caused by the toxin on the blood vessel. So you can clearly see the significant perivascular and vascular intramural edema often seen on the white matter of the brain, and then this edema is protein rich, showing that the blood-brain barrier has been compromised. So what you have seen in the picture is the acidophilic or the bright pink part is, especially in the perivascular area, is the edema, that is a protein-rich fluid that is leaked out of the vessel, in which the toxin released by the Clostridium perfringens is causing vascular permeability. And when there is increased vascular permeability caused by vasodilation, the fluids are leaked out on the vessel wall, leading to this type of intramural edema in the brain. Still, under the histopathologic findings, so on the left side is the microscopic lesion of the gastrointestinal tract, specifically the lamina propria, that presents a severe diffuse hemorrhage and infiltration with inflammatory cells such as neutrophils, plasma cells, lymphocytes, and macrophages in the hematoxylin and eosin stain. So the lamina propria is part of the mucosa of a tubular organ, in which this picture shows that the lamina propria is heavily infiltrated with neutrophils, plasma cells, lymphocytes, and macrophages. And then this necrosis of the villi tips means that the gut is no longer able to function properly, showing or allowing the toxins to be absorbed directly into the bloodstream. And then on the right side of the picture is the microscopic lesion of the kidney of the lamb, in which the renal cortical tubular epithelial cells contain numerous round variably sized brightly eosinophilic intracytoplasmic hyaline protein droplets, or the hemoglobinuric nephrosis. So this is a high magnification view of the kidney, in which the epithelial cells lining the renal tubules contain numerous round pinkish red eosinophilic hyaline protein droplets. So there are hemoglobin reabsorption droplets, directly confirming the presence of massive hemolysis and the cause of the gross dark red kidney, or the hemoglobinuric nephrosis, as I have mentioned earlier. Still under the histopathologic findings, lastly is on the center is the picture of microscopic sections of lung of a cattle that is infected with Clostridium perfringens, showing fibrinous materials, edema, and extensive inflammatory reaction. So this is a microscopic section of a lung that shows a strong fibrinous and inflammatory reaction. So the alveoli are filled with pink stringy fibrin edematous fluid and many inflammatory cells that confirms a severe acute respiratory disease or acute respiratory distress that can occur on fatal cases of Clostridial infection. Now, we will discuss the critical strategies for preventing and controlling the Clostridial enterotoxemia in ruminant populations. So, these diseases are often caused by Clostridium perfringens, typically the type D, and it can be rapidly fatal. So, making proactive management is essential. So, our approach here focuses on several key areas as what I have outlined on this slide. So first is the vaccination. So vaccination is arguably the cornerstone of prevention, and then we can use specific Clostridial toxoids to stimulate immunity in the animals. It is vital to ensure that the breeding stock, particularly the pregnant ewes and cows, are vaccinated for a few weeks before calving or lambing, and then this ensures that there is a protective antibodies that can be passed on to the offspring through the colostrum, offering crucial early protection during their most vulnerable period. Second is the feeding management. So we have the proper feeding management is paramount. So sudden changes in diets, especially the rapid introduction of a highly concentrated feeds or lush pasture, is often triggers for enterotoxemia because they alter the gut environment, allowing the Clostridial bacteria to proliferate. So for the feeding management, we can classify them into three. First is the gradual transition, in which all the feed changes must be introduced gradually over 1 to 2 weeks. Second is the consistent rations, in which we must maintain the consistent feeding times and ration composition. And lastly is we must avoid overfeeding because it ensures that the animals are not overfed, of course, and as excess or exceeding amounts of feed can lead to undigested material in the gut, a perfect substrate for bacterial growth. Then we have here the probiotics. So the use of probiotics can be a valuable supplementary measure by introducing the beneficial bacteria into the ruminant's gut. We help to maintain a balanced microbial population, and then this competitive exclusion helps suppress the growth of pathogenic Clostridia, contributing to overall gut health and resilience against the disease. Next is the good hygiene. So we must maintain a clean environment, and it is a basic but effective control measure. So we must ensure that the housing areas are clean, particularly the calving and lambing pens. And then we must sanitize all the equipment by regularly cleaning and sanitize the feeding and watering equipment, and then the management of waste. So we must prefer the proper disposal of waste that reduces the overall bacterial load in the environment. And then next we have here the antibiotics. So antibiotics are generally used for treatment rather than prevention in this context. However, they may be administered in specific risk situations or high risk situations under veterinary supervision, such as during an active outbreak or to a high value animals showing early signs of distress. So their use should be targeted to avoid contributing to antibiotic resistance. Next is the quarantine. So we must implement strict quarantine protocols for new arrivals is essential, in which the new animals may carry different strains of Clostridia or other pathogens. A quarantine period allows for observation and potential vaccination boosters, and prevents the introduction of new disease threats into the existing herd or flock. And then lastly is the outbreak control. So we must all remember this, that in the unfortunate event of an outbreak, rapid response is the key, in which we must seek professional help immediately for diagnosis and treatment protocols via immediate veterinary consultation. And the next is the segregation, that involves separating the sick animals from healthy ones immediately, and then environmental cleanup that intensify hygiene measures in affected areas, and then mass vaccination and treatment, in which the veterinarian may recommend some emergency vaccination of the remaining healthy stock or strategic antibiotic treatment to halt the spread of the disease. So by integrating these strategies, we can significantly reduce the incidence and impact of Clostridial enterotoxemia in ruminant populations. So we must safeguard the health and productivity of our ruminant livestock. Thank you.